Benjamin Netanyahu, now 76, recently revealed he was treated for early-stage prostate cancer. Now, this video is not about politics. It is about a health lesson every man over 60 should hear. Prostate problems can look small at first. Waking up at night, a weaker urine stream, a little more urgency, and many men simply blame aging. But sometimes, those small changes are your body asking you to get checked. Today, I'll explain what older men should learn from this news, without fear, without politics, and without guessing. Before we talk about symptoms, let's first understand why this news matters for men over 60. My name is Dr. Sam Thompson. I'm 72 years old, and I spent many years helping older adults protect their health, their dignity, and their independence. You may have seen the news about Benjamin Netanyahu and prostate cancer. He is 76 years old. According to recent reports, he said doctors found and treated a small prostate tumor after follow-up care from earlier prostate surgery. The report said he received radiation therapy and described the cancer as early stage. Now, I want to say this clearly. This video is not about Netanyahu's politics. It is not about Israel. It is not about war. It is not about taking sides. It is about something much closer to home. It is about the health lesson every older man can take from this story. Because after 60, prostate issues become much more common. Some are harmless, some are uncomfortable, some are treatable, and some deserve medical attention. The tricky part is that prostate symptoms can feel ordinary. A man wakes up more often at night and says, "Well, I'm getting older." His urine stream becomes weaker, and he says, "That's probably normal." He feels a little urgency and says, "Maybe I drank too much coffee." And sometimes he is right. Many prostate symptoms are caused by an enlarged prostate, also called BPH. They can also be caused by infection, diabetes, medications, caffeine, dehydration, or bladder changes. So I do not want you to panic, but I also do not want you to ignore a pattern.
Now let's look at why prostate changes are so common after 60, and why symptoms can be easy to misunderstand. The prostate is a small gland that sits just below the bladder. It surrounds the urethra, which is the tube that carries urine out of the body. When the prostate is healthy and not pressing on that tube, urine can flow more easily. But as men get older, the prostate often changes. It may enlarge, it may become inflamed, it may press on the urethra. And when that happens, the bladder has to work harder. That is why many men over 60 notice changes in urination. They may wake up at night, they may have a weaker stream, they may feel like they cannot empty the bladder fully. They may feel sudden urgency. Now, again, these changes do not automatically mean cancer. In fact, many urinary symptoms in older men are more likely to be caused by something else, such as BPH, infection, medication side effects, diabetes, or bladder irritation. The American Cancer Society notes that many symptoms linked with prostate cancer are more often caused by other conditions. But here is the important part. Common does not mean harmless. If a symptom is changing your sleep, your confidence, your daily routine, or your ability to leave the house comfortably, it deserves attention. And if several symptoms appear together, it deserves even more attention. I used to tell my patients this: do not diagnose yourself in silence, and do not dismiss yourself in silence either. Your job is not to decide whether it is cancer. Your job is to notice the change and bring that information to someone who can help. A doctor can ask questions, review medications, check for infection, discuss prostate testing, and decide whether you need a urologist. That is how we move from worry to clarity. And clarity is always better than guessing.
Let's begin with the bathroom signs men often notice first, but also often ignore. The first warning sign is frequent urination at night. Now, getting up once at night can happen for many reasons. Maybe you drank tea late, maybe you had soup for dinner, maybe you take a water pill, maybe your sleep is light. But if you are waking up 2, 3, or 4 times a night to urinate, especially if this is new for you, pay attention. Nighttime urination can happen when the bladder is irritated or when it does not empty completely. The second sign is a weak or interrupted urine stream. Maybe the stream is thinner than before. Maybe it starts and stops. Maybe it takes longer to finish. Maybe you feel like you have to strain. A weak stream can happen when urine has trouble passing through the urethra. The third sign is difficulty starting or stopping urination. You feel the urge to go, but nothing happens right away. You wait. You strain. You stand there longer than you used to. Or when you finish, the flow dribbles or does not stop cleanly. The fourth sign is feeling like your bladder does not fully empty. You finish urinating, walk away, and then a few minutes later, you feel like you need to go again. That can be frustrating. It can also be a clue that the bladder is working against resistance. The fifth sign is sudden urgency. This is not just, I need to go soon. This is, I need a bathroom right now. Some men start planning their day around bathrooms. They avoid long drives. They choose the aisle seat. They stop drinking water before leaving the house. And slowly, their world gets smaller. That matters, because the goal of Stay Independent 60 Plus is not just to help you live longer. It is to help you live with confidence. The CDC lists symptoms such as difficulty starting urination, weak or interrupted urine flow, urinating often at night, and trouble emptying the bladder completely. Among symptoms men should discuss with a doctor. Remember the rule. One bathroom change once in a while may not mean much, but a pattern deserves attention. Now, let's talk about symptoms many men feel embarrassed to mention, but should not hide. Some symptoms are harder to talk about, but private symptoms still matter. The sixth warning sign is pain or burning during urination. Some men describe it as stinging. Some feel it at the start. Some feel it at the end. Some feel pressure deep in the pelvis. Now, burning urination is often caused by something other than cancer. It may be a urinary tract infection. It may be prostatitis, which means inflammation of the prostate. It may be irritation, medication changes, or dehydration. But if it keeps happening, it should not be brushed aside. Pain is information. The seventh sign is painful ejaculation. I know this is a sensitive topic, but I want to speak plainly and respectfully. The prostate helps produce fluid that is part of semen. It also sits close to nerves and muscles involved in ejaculation. So if ejaculation becomes painful, uncomfortable, or suddenly different, it is worth mentioning to your doctor. You do not need to be embarrassed. Doctors hear these concerns every day. The eighth sign is new or worsening erectile difficulty. Erectile changes are common as men age. They can be related to blood pressure, diabetes, heart disease, stress, medications, sleep, low testosterone, or relationship factors. But if erectile changes appear suddenly, worsen quickly, or come together with urinary symptoms, pelvic pain, or blood, they deserve evaluation. Here is the gentle rule. If something changes in your urinary or sexual health and keeps coming back, tell your doctor. You are not being dramatic. You are being responsible. Before we continue, let me ask you something. Which symptom do you think men are most likely to ignore? Waking up at night? A weaker stream? Pain or burning? Or private symptoms they feel embarrassed to mention? Write one word in the comments. Your answer may help another man realize he is not alone. Now we move to one sign I never want a man to explain away. Blood. The 9th warning sign is blood in the urine or semen. This is one I do not want you to explain away. Blood in the urine may look pink, red, tea-colored, brown, or rusty. Blood in semen may appear as red or brown streaks. Sometimes it appears once and disappears, and that is exactly why some men ignore it. They say, well, it went away. But blood does not appear without a reason. It may be caused by infection, stones, inflammation, injury, an enlarged prostate, medications, or cancer. Next, let's talk about discomfort that may not seem connected to the prostate at first: pelvic, back, and hip pain. The point is not to assume the worst. The point is to get checked. Mayo Clinic lists blood in the urine or semen among symptoms that can occur with prostate cancer, along with trouble urinating, decreased force in the urine stream, bone pain, unexpected weight loss, and unexplained fevers. Mayo Clinic also advises seeing a doctor if these symptoms are consistently noticed. So if you see blood, call your doctor. Do not wait 3 months to see if it returns. Do not ask the internet to diagnose it. Do not feel embarrassed. A simple urine test, exam, and follow-up can often help narrow down the cause. And if something serious is going on, early attention gives you more options. That is what I want for you. More options, more clarity, more peace of mind. Blood is not a symptom to fear silently. It is a symptom to report.
Next, let's talk about discomfort that may not seem connected to the prostate at first: pelvic, back, and hip pain. The 10th warning sign is persistent pelvic discomfort. This may feel like pressure low in the pelvis, a dull ache, a heaviness, a feeling of fullness, discomfort when sitting. Now, pelvic discomfort can come from many causes: muscle tension, constipation, bladder irritation, prostatitis, hip or spine problems. But if pelvic discomfort lasts for weeks, keeps returning, or comes with urinary changes, it is worth discussing with a doctor. The prostate sits in a crowded neighborhood. The bladder is above it. The rectum is behind it. The urethra passes through it. Nerves and muscles surround it. So when something is irritated in that area, the discomfort can be hard to describe. The 11th warning sign is ongoing lower back, hip, or upper thigh pain. Now, let's be careful. Most back pain is not prostate cancer. Most hip pain is not prostate cancer. Many older adults have arthritis, disc problems, muscle strain, or posture-related pain. But persistent bone pain, especially if it is new, unexplained, worse at night, or not improving with usual care, should be checked. The American Cancer Society notes that advanced prostate cancer may cause pain in the hips, back, ribs, or other areas if it is spread to bones, and may also be linked with weakness, numbness, weight loss, or feeling very tired. So here is the practical rule. If you lifted a heavy box yesterday and your back hurts today, that may be muscle strain. But if you have deep pain in the back, hips, or pelvis that keeps returning, worsens at night, or comes with urinary symptoms, weight loss, or weakness, do not ignore it. Pain is not something to tough out forever, especially when it is new, persistent, or unexplained.
Now, let's move from local symptoms to whole body changes. the signs many men dismiss because they seem unrelated. The 12th warning sign is unexplained weight loss or loss of appetite. Now, losing weight on purpose through healthier eating and movement can be a good thing. But losing weight without trying is different. Maybe your pants feel loose. Maybe your face looks thinner. Maybe the number on the scale drops and you are not sure why. Or maybe food simply does not interest you the way it used to. You feel full sooner. You skip meals. You do not enjoy your usual foods. These changes can happen for many reasons. Depression, medication side effects, dental problems, digestive issues, thyroid disease, infection, cancer. So we never jump to one conclusion. But unexplained weight loss and ongoing appetite loss should be evaluated, especially if they come with pain, fatigue, urinary symptoms, or weakness. The 13th warning sign is persistent fatigue or weakness. Not ordinary tiredness after a busy day. I mean fatigue that does not improve with rest. You sleep but wake up tired. You walk upstairs and feel unusually weak. You carry groceries and feel drained. You sit down more often because your body feels heavy. Fatigue can come from anemia, poor sleep, heart problems, depression, low vitamin levels, medication side effects, infection, hormone changes, and many other causes.
But if it is new, persistent, or getting worse, it is worth checking. This is especially important for men who say, "I'm just getting old." Aging may slow us down a little, but sudden or steady decline deserves answers. The goal is not to scare you. The goal is to notice when your body changes in a way that is not normal for you. Because the earlier you ask questions, the more time you have to find solutions. Now that we've covered the warning signs, let's talk about the most important part. When should you call your doctor?
Here is the Dr. Sam rule. Call your doctor if a symptom is new, persistent, getting worse, or happening together with other symptoms. Let me say that again. New, persistent, getting worse. Before we close, let's quickly review the 13 warning signs in a simple way you can remember. Or happening together. For example, waking up once at night may not mean much, but waking up 3 times with a weak stream and trouble emptying your bladder deserves attention. Mild back pain after yard work may not mean much, but deep back or hip pain that is unexplained, worse at night, and paired with weight loss deserves attention. One episode of urgency after too much coffee may not mean much, but urgency that keeps happening, especially with burning, blood, or pelvic pain, deserves attention. When you call your doctor, you can say something simple. I've noticed changes in my urination, and I'd like to talk about my prostate.
That is enough. Your doctor may ask about your symptoms, medications, family history, urinary habits, and overall health. They may suggest a urine test, blood work, a PSA discussion, a prostate exam, imaging, or referral to a urologist. Now, PSA screening is not one size fits all. The National Cancer Institute explains that prostate-specific antigen, or PSA, testing can be used for screening or follow-up, but screening decisions involve possible benefits and harms. The CDC says men age 70 and older should not be screened routinely if they have no symptoms, though other organizations may differ. This is why the best step is a personal conversation with a clinician. So ask your doctor, given my age, health, family history, and symptoms, should I have prostate testing? That is a wise question. Not fearful, not embarrassed, wise.
Before we close, let's quickly review the 13 warning signs in a simple way you can remember. Let's review the 13 prostate warning signs men over 60 should not ignore. Number 1, frequent urination at night, especially if you are waking up more often than usual. Number 2, weak or interrupted urine flow, a stream that is slower, thinner, or stops and starts. Number 3, difficulty starting or stopping urination, waiting longer, straining, or having more dribbling than before. Number 4, feeling like the bladder does not fully empty, needing to go again soon after finishing. Number 5, sudden urgency, a strong need to urinate that comes quickly and feels hard to control. Number 6, pain or burning during urination, especially if it keeps happening. Number 7, painful ejaculation, a private symptom, but an important one to mention. Number 8, new or worsening erectile difficulty, especially if it comes with urinary or pelvic symptoms. Number 9, blood in the urine or semen. Even if it happens only once, call your doctor. Number 10, persistent pelvic discomfort, pressure, heaviness, or aching that does not go away. Number 11, unexplained lower back, hip, or upper thigh pain, especially if it is deep, persistent, or worse at night. Number 12, unexplained weight loss or loss of appetite, especially when you are not trying to lose weight. Number 13, persistent fatigue or weakness, tiredness that does not improve with rest. Now remember, these signs do not automatically mean prostate cancer, but they do mean your body may be asking for attention. And attention is not fear. Attention is wisdom. And now let me leave you with the real lesson from Netanyahu's prostate cancer news. Here is the real lesson from this news. It is not that every urinary change is cancer. It is not that men should panic. And it is not that age means decline is unavoidable. The lesson is this: when something changes in your body, pay attention early. Taking care of your prostate is not just about preventing disease. It is about protecting your sleep, your comfort, your confidence, your relationships, your ability to leave the house without worrying where the bathroom is. It is about protecting your independence. If something has changed, do not sit with worry in silence. Make the call. Ask the question. Get the checkup. You do not need to diagnose yourself. You only need to notice what is changing and bring that information to someone who can help. If this video helped you understand prostate warning signs more clearly, please subscribe to Stay Independent 60+. Here, we talk about senior health in a calm, honest, practical way, without fear, without politics, and without confusing medical language. And before you go, leave a comment below. Which symptom do you think men over 60 ignore the most? Waking up at night? A weak urine stream? Blood in the urine? Back or hip pain? Or constant fatigue? I read your comments, and they help me choose the next topic for Dr. Sam to explain. And one more thing. If you know a husband, brother, father, or friend over 60 who keeps brushing off prostate symptoms, share this video with him. Not to scare him, to help him pay attention sooner. This is Dr. Sam Thompson. Take care of your body. Listen to the signals. And remember, small steps today can protect your independence tomorrow. Subscribe to Stay Independent 60+ for calm, practical senior health advice.